Hi, Dr. Paul here. I want to talk about the subject of trauma. I talk a lot about on the show about the reasons why people suffer with certain things like depression or anxiety or bipolar disorder, ADD. I also treat a lot of PTSD in my practice. I see a lot of veterans from the Persian Gulf War, Vietnam, even Korea. And that's the classic thing we hear. But when we think PTSD, we think about veterans of wars. But it's not just that. I think trauma can happen in many ways. There's physical trauma. There's a lot of trauma. Like some people growing up have a lot of very difficult upbringing with unhealthy parents that traumatize them, and they get either emotionally abused, physically abused, sexually abused. So there's a lot of ways that people can experience trauma. There's victims of crime, victims of rape, and also actually witnessing a crime also and seeing someone else, that's very traumatic. And that leaves an imprint on the brain that really affects people. You hear me talk about in the show about the main reason why these diagnoses happen is genetics, which is also why a lot of people don't understand it, because some people who have it really good feel not so good, and they don't understand why. Well, look at your parents, look at your siblings, look at family history. That's the number one reason. Number two reasons is when hormones are changing, like in puberty, which is why the teenage years can be very difficult. Menopause, menopause for men, midlife crisis for men. Postpartum for women after having child. So there's definitely hormonal elements, but what sometimes is not talked about is the trauma. So that's the third part I talk about in my books. I talk about a lot is the effect that trauma has on the brain, and it throws things off. And if someone has no family history that's significant, no significant hormonal changes going on, sometimes just the trauma is all it takes to throw things off. And yes, therapy can definitely help, no question about it. And if someone has a significant trauma, they should definitely seek out therapy. But medications are very helpful to try to rebalance the chemistry that was thrown off because of the trauma. So I've had a lot of patients with trauma, and when I treat them properly, they feel like they did before the trauma. They said it feels almost like it didn't even happen now. And because it takes them back, because it's rebalancing what's in their system that got thrown off. And that's the goal and so not to discount the importance of medical treatment and understanding that medications are your friend, not your enemy when you need them. That's probably the most misunderstood part of what I do is the role of medications, and why they're such a great thing that we have as a tool, and why they're so misunderstood. So anyway, if you have any trauma that you've been dealing with and it's affecting you or not getting through it, you seek out help and call me and call my office, talk to Leslie, and then we'll set up an appointment for you and we can talk about it. And then I can help you even find a therapist if need be. So anyway, it's something that we really need it's a serious subject that needs serious attention. Thanks for listening.